Welcome back to Today on Bay TV. I'm Gaynor Morgan, this is Henry Darby-Cook, and we welcome back our favourite osteopath, Rebecca Wedlake. Thanks, Rebecca. And of course, Keith has joined us again. Thank you, Keith.
So what are the key ideas we're going to talk about today, Rebecca?
Well, today what we're going to discuss is what you can expect when you first visit an osteopath at the actual first appointment.
Because I guess it could be quite daunting for someone who's never been before.
Yeah, especially if you've never had any kind of manual therapy before, or if you've just been used to going to, when you go to a GP, for example, you normally get about 7 to 10 minutes with them in chat, quick examination and out. When you see an osteopath, your first appointment's approximately an hour.
OK.
So you get up to an hour 15, depending on the complexities of the appointment. So it is quite in-depth. There's quite a lot of things to discuss at that
If you're going the first time, though, it can be daunting, as you say, Henry. You know, do you have to undress? You know, what's...
Yeah, you do. We will ask our patients to undress, but it's really important that we explain to you why that, because you might say, well, hang on a minute, you know, I know I've said about shoulders before, but if it's just my shoulder, can't I just kind of do that? We're looking at you head to toe. So we'll ask you to undress down to your underwear, or if you say to us, well, actually, you know, I'd rather wear a camisole top and a pair of shorts or something, we're about respecting your dignity. But we need to see you from head to toe to be able to see fully.
In my experience, it's quite discreet. You're asked to go behind a screen and change, and then you put this sort of inverted gown thing on.
With osteopaths, we'll step out of the room usually, we'll ask you to get undressed, and then when we've done the examination, we'll ask you to stand, we'll look at you from different areas, it'll involve us putting our hands on you to palpate those tissues, feel where the pain is. We'll get you to lie down, and usually we'll cover you with things like towels to maintain your dignity at all times, but so that we can appropriately assess you and get to the root of what the problem is.
So in the end, you want to cure the pain, don't you?
I'm just wondering what osteopathy actually is.
Well, quickly to recap, it's a system of diagnosis and treatment. We're primary healthcare practitioners. So what we'll do is we'll do things like manipulate joints, we'll assess you, then do the appropriate testing depending on what needs to be done. And we'll do things like soft tissue, so your remedial massage, manipulating joints, which is clicking if necessary. Some people don't want that, and that's totally fine. Yeah, if you come in and said to me, I don't want to be clicked, that's completely your choice. We have other techniques that we can use. It's not solely clicking.
I know you're supposed to trust, but I just think...
Well, you know, we'll explain every step of the way, and we do things like mobilising, which is moving joints. We'll do things like other modalities and things such as exercise prescription, rehabilitation advice, lifestyle advice. So example, if you sat down and we were talk about posture and ergonomics, what you could be doing at work.
Sitting up straight.
We're all having a go now.
I have to say, I might have put people off with the click, but you don't have to have a click because the bench will do it for you. They can
That's chiropractors.
Right.
With osteopaths, we use our hands.
Yeah.
But even if you didn't hear a click when we're manipulating you, when we're doing that thing, it's the actual act of getting the movement into that joint, breaking the pain cycle, increasing blood flow, nutrient exchange. So you don't actually have to hear an audible pop to get benefit. But there's so many things we can do.
What is the pop? I've always wondered, is it...
It's a little, when you gap the joint, and it's a little bubble that escapes.
Okay,
and you can
so
hear
nothing
a
to
little
worry
click.
about, it's just
It's not a bone breaking, it's not a ligament snapping or anything like that, you know, just to let people know, because it's really important that people know that treatment shouldn't hurt. It doesn't hurt. We'll do everything we can to make your treatment as painless as possible. Now, you might experience some discomfort, but we'll feed back to you. If there's going to be a technique we do and we think, right, that is going to be, you know, there is going to be discomfort, especially if you're in acute pain, we'll talk you through it. We'll say to you, if at any point in time you are in discomfort, you can tell us, we can stop. It's all about bridging communication, and it's fear of the unknown. If you know when we talk about it with your head, then you've got an idea what to expect.
Is it for everyone, you know, of all ages?
Well, what happens is when you come for your first appointment, what we do is we'll be asking you questions about your medical history, your current symptoms, any past experiences that you've had, any past ill health within the medical history. Are you taking any medications? What do you do? What are your hobbies? It's to get a massive picture of you, and then we'll do the examination, we'll do any appropriate testing. It's suitable from age 0 to 100, but there may be occasions where your symptoms are actually outside of the scope of our expertise, and at that point in time, I won't turn around to a patient and say, oh, I'm sorry, can't treat you, nothing I can do. we keep in touch with your GPs. We'll get your permission. We will write a letter to your GP saying our findings so that if it is outside of our expertise, we are referring you on appropriately to someone else who might be able to help you, because especially you can have different referrals and things.
Also, you might think that there's something sinister going on and you wouldn't... People wouldn't come to an osteopath really for that, would they?
They may not realise, but we're trained to look for these things. We're trained to look for these red flags. So that's an excellent question. And if we see certain things, we know then, right, we've got to formulate a plan, and we will look to refer on. And sometimes you can refer on but still continue to treat, depending on why you're referring. But those are great questions.
So you've touched on how long the first examination might take, but for anyone who's thinking, no, I've got a bit of an ache and pain and I think I need to go for my first time, what else could they expect?
Well, it'll be, we're going to ask you we'll do all the questions, we'll do all the actual examination, you'll stand, we'll look at you from 4 angles, put our hands on you, whatever testing we feel is appropriate. And then we'll get you to sit down and we'll start hopefully doing treatment at that first appointment. Start looking at things that are outside. So if, for example, you're working at a desk and you've come in and you've got achy shoulders, achy neck, I might suggest ergonomics, go back to your workplace, have a chat with them. Little things around that. We could be giving you stretches to do at home, because it's not just what I do in the treatment room. It's what you can do, because we want to empower you in your own health.
If we have aches in our shoulders, is there anything that we could do, exercises ourselves?
Oh, a nice massage.
Yes, please.
It's a brilliant question, but I always say to people that it's better to have an examination, because you don't know, are they aches from postural issues? Is it a referral from a disc? Is it a referral from bone? Is it soft tissue? Is it a referral from somewhere else? You might come in with shoulder pain, thinking, that's because I picked something up funny last week. Could be a referral from an organ. So we've got to make sure that we do a full comprehensive examination to justify a really good treatment plan or know what to do next. It's an excellent question, but I would have to do an examination.
What does the word actually mean?
Osteopathy, to do with osteopathy, to do with bone, because when Andrew Taylor Still actually invented it, because he was a doctor, and
when was that?
Back in 1867, I believe, something back in
Now you're testing again.
But it's to do, because osteo is the bone, so, it's through the treatment of and its own diagnosis
I
system.
Latin for bone, but it seems a lot more.
Yeah, and it's structure governs function. So it's all about, we know if you're structurally fine, your body will function well. If your body's not functioning well, we're going to look at the structure of it to figure out
what happens if your head's gone.
With this manipulation, does the treatment hurt?
We do everything we can to limit that. You shouldn't feel pain. You may have some discomfort, and you may have what's called a treatment reaction. So you could find for 24 to 48 hours after your appointment, you could feel a little bit of an increased pain or some new pain in that area. Some patients get a bit tired. Some patients get a bit hungry. There are a whole variety of treatment reactions, but we'll talk you through those and we'll advise you on what to do should you have these treatment reactions. But it's all about reassuring the patient that, these are completely normal, but don't hesitate to call us.
That's great. Thank you very much.